Hey guys, welcome back to my YouTube channel.
Hey, my name is JOHNNYJUNJOJOJRQUINRAMOS, aka Johnny Juan Jojo Jarcun Ramos. Today we are going to talk about the digoxin and a case that goes along with it. Digoxin is used for rhythmic and blood pressure support. It can treat heart failure and heart rhythm problems. Digoxin is classified as cardiac glycoside. People who take too much of digoxin can get poisoned. You can also get poisoned if you eat plants such as foxglove that contains a similar substance. Therapeutic levels of digoxin are 0.8 to 0.2 nanogram per milliliter. The toxic level is more than 2.4 nanogram per milliliter. The lethal dose for digoxin is considered to be 20 to 50 times the maintenance dose taken at once. In healthy adults, a dose of less than 5 milligrams seldom causes severe toxicity, but a dose of more than 10 milligrams is almost always fatal. Digoxin is measured in nanograms, ml. Digoxin is a cardenolide glycoside that is digitoxin beta hydroxylated at C12. It is also colorless and bitter solid. Their function is to slow your heart rate down and improve the filling of your ventricles of the chambers of the heart with blood. For people with atrial fibrillation, where the heart beats irregularly, a different volume of blood is pumped out each time. This means an irregular amount of vital oxygen is sent to the brain and the rest of the body, which can lead to symptoms like lightheadedness and lethargy. If you have heart failure, your heart muscle has become less effective at pumping blood around the body, so allowing it more time to fill with blood before it pumps can help to improve symptoms. Side effects include nausea, vomiting, diarrhea, tiredness, insomnia, visual disturbances, palpitations, and fainting. In rare cases, increased levels of digoxin in your blood can cause heart rhythm disturbances or arrhythmias. A digoxin test is a blood test that your doctor can use to determine the level of the medication digoxin in your blood. The healthcare provider at the lab will draw blood from your arm or hand with a needle. Some lasting effects of digoxin are changes in vision, behavioral changes, weight loss, and many more. Charles Cullen is from New Jersey. He did not have a good childhood growing up. He describes his childhood as miserable. His father died when he was an infant and his mother died when he was 17 years old. He dropped out of school and enlisted into the Navy, which he later went on to become a nurse. He claimed that he did not like people suffering at hospitals. He later went on taking innocent people's lives. In 1988, his killing spree began after he had killed 11 people. He left in 1992 after police started an investigation. In that same year, Cullen started to act weird, having domestic violence complaints. He was abusive to pets, would prank call funeral homes, and was said to be an alcoholic. Cullen moved from hospital to hospital and would inject people with digoxin and insulin. He would even inject it into healthy people. It started to get suspicious because people that were fine were starting to die. In 2003, he was working at the Somerset Hospital when they found him with records of patients he was not assigned to. Co-workers were seeing him in patients' rooms. Computerized drug dispensing cabinets were showing that Cullen was requesting medications that patients had not been prescribed. Cullen decided he was not done and continued his killing spree, killing 5 more people. His final victim had said that a sneaky male nurse had injected them when they were sleeping, but people just dismissed her comment. When Cullen's final victim died of low blood sugar in October, the medical center altered state authorities. An investigation into Cullen's employment history revealed past suspicions about his involvement with prior deaths. Somerset Medical Center fired Cullen on October 31, 2003 for lying on his job application. Police kept him under surveillance for several weeks until they had finished their investigation. He was then arrested on June 18, 2003. Cullen confessed to killing up to 40 patients. He was sentenced to 11 life terms.